Alzheimer's disease, also referred to simply as Alzheimer's, is a chronic neurodegenerative disease that usually starts slowly and gradually worsens over time. Initial symptoms are often mistaken for normal aging. It is the cause of 60 to 70% of cases of dementia or loss of memory. The most common early symptoms is difficulty in remembering recent events. As the disease advances, symptoms can include problems with language, disorientation, including easily getting lost, mood swings, loss of motivations, not managing self-care, and behavioral issues. Approximately 10% of all persons aged greater than 70 years have significant memory loss, and in more than half the cause is Alzheimer's disease. In typical amnestic Alzheimer's disease, brain atrophy begins in the medial temporal lobes before spreading to lateral and medial parietal and temporal lobes. And the signs and symptoms? The disease course is divided into 4 stages with a progressive pattern of cognitive and functional impairment. First is the pre-dementia. The most noticeable deficit is a short-term memory loss, which shows up as difficulty in remembering recently learned facts and inability to acquire new information. Subtle problems with excessive function or executive functions of attentiveness, planning, flexibility, and abstract thinking, or impairments in semantic memory or memory of meanings and concept relationships can also be symptomatic of the early stages of Alzheimer's disease. Apathy can be observed at this stage and remains the most persistent neuropsychiatric symptom throughout the course of the disease. The preclinical stage of the disease has also been termed mild cognitive impairment. And the early symptoms? The increasing impairment of learning and memory eventually leads to a definitive diagnosis. Alzheimer's disease does not affect all memory capacities equally. Older memories of the person's life, or episodic memory, facts learned or semantic memory, and implicit memory, or the memory of the body on how to do things, such as using a fork to eat or how to drink from a glass, are affected to a lesser degree than new facts or memories. Language problems are mainly characterized by a shrinking vocabulary and decreased word fluency, leading to a general impoverishment of oral and written language. As the disease progresses, people with Alzheimer's disease can often continue to perform many tasks independently, but may need assistance or supervision. And moderate symptoms, progressive deterioration eventually hinders independence, with subjects being unable to perform most common activities of daily living. Speech difficulties became evident due to an inability to recall vocabulary, which leads to frequent incorrect word substitutions or paraphasias. Reading and writing skills are also progressively lost. Motor sequences become less coordinated as time passes, and Alzheimer's disease progresses, so the risk of falling increases. During this phase, memory problems worsen, and the person may fail to recognize close relatives. Long-term memory, which was previously intact, becomes impaired. Behavioral and neuropsychiatric changes become more prevalent, leading to crying, aggression, resistance to caregiving. And subjects also lose insights for this disease process and limitations. Urinary incontinence can develop. These symptoms create stress for relatives and the one who cares. And in the advanced, during the final stage, the patient is completely dependent upon caregivers. Extreme apathy and exhaustions are much more common symptoms. People with Alzheimer's disease will ultimately not be able to perform even the simplest tasks independently. They are bedridden and unable to feed themselves. The cause of death is usually an external factor, such as infection of pressure ulcers or pneumonia, not the disease itself. And what causes the Alzheimer's disease? Exact cause is not known. Smoking is a significant risk factor, and a history of head trauma increases the risk of AD. About 70% of the risk believed to be inherited from a person's parents, with many genes usually involved. Other risk factors include a history of health injuries, depression, and hypertension. There are widespread of neurotic plaque containing amyloid beta in the brain and accumulation in blood vessel walls in cortex and left meninge. The disease process is associated with plaques and neurofibrillary tangles in the brain, and the major genetic risk for AD is the E4 allele of the polyphosphate and E genes. Carrying one E4 allele increases the risk for AD by 2 to 3-fold, whereas two alleles increase the risk 16-fold in both sexes. As a person's conditions declines, gradually, bodily functions are lost, ultimately leading to death. Although the speed of progression can vary, the typical life expectancy following diagnosis is 3 to 9 years. Alzheimer's disease is usually diagnosed based on the person's medical history from relatives, and behavioral observations. The presence of characteristics neurological and neuropsychological features and the absence of the alternative conditions is supportive. Advanced medical imaging with computed tomography or magnetic resonance imaging or MRI and with single photon emissions computed tomography or SPECT or positron emission tomography or PET can be used to help exclude other cerebral pathology or subtypes of dementia. To prevent Alzheimer's disease, cardiovascular risk factors such as hypercholesterolemia, hypertension, diabetes, and smoking are associated with a higher risk of onset and worsened course of AD. Blood pressure medications may decrease the risk. Long-term usage of non-steroidal anti-inflammatory drugs were thought to be associated with a reduced likelihood of developing AD. People who engage in intellectual activities such as reading, playing board games, completing crossword puzzles, playing musical instruments, or regular social interaction show a reduced risk for Alzheimer's disease. Education delays the onset of AD syndrome without changing the durations of the disease. Learning a second language even later in life seems to delay the onset of Alzheimer's disease. Physical activity is also associated with a reduced risk of AD, and physical exercise is associated with decrease of dementia. It is also effective in reducing symptom severity in those with Alzheimer's disease. People who maintain a healthy Japanese or Mediterranean diet have a reduced risk of AD. A Mediterranean diet may improve outcomes in those with the disease. Those who eat a diet high in saturated fats and simple carbohydrates, such as mono and discarnate, have a higher risk. The Mediterranean diet's beneficial cardiovascular effect has been proposed as the mechanism of action. Here is a tentative evidence that caffeine may be protective. A number of foods high in flavonoids such as cocoa, red wine, and tea may decrease the risk of AD. And treatment for Alzheimer's disease? We can say that there is no cure for AD. Available treatments offer relatively small symptomatic benefit but remains palliative in nature. Current treatments can be divided into pharmaceutical, psychosocial, and caregiving. 5 medications are currently used to treat the cognitive problems of AD. 4 are acetylcholinesterase inhibitors such as tacrine, ribastigmine, galantamine, and donepezil, and the other, memantine, is an MMDA receptor antagonist. The benefit from their use is small. No medications has been clearly shown to delay or halt the progression of the disease. Acetylcholinesterase inhibitors are employed to reduce the rate at which acetylcholine is broken down, thereby increasing the concentrations of ACH in the brain, and the combination of the loss of ACH caused by the death of cholinergic neurons. There is evidence for the efficacy of these medications in mild to moderate Alzheimer's disease, and some evidence for their use in the advanced stage. Atypical antipsychotics are modestly useful in reducing aggression and psychosis in people with Alzheimer's disease.